name is Ali Peterson, and I'm a family nurse practitioner and a nurse midwife. I'll be seeing women under the age of 50 and women of childbearing age, pregnant patients, and women in general for just all of their preventative healthcare needs. I'll also focus on pediatrics, seeing newborns and kids up to age 18. I went to school at North Dakota State University for my undergraduate degree. Then I went to South Dakota State University for my nurse practitioner degree in 2016. I graduated, and so I've been working as a family nurse practitioner for the past 6 years, and just recently I graduated from Frontier Nursing University based out of Kentucky. They were the first midwifery program in the nation and really do a great job with distance education and educating nurse midwives in their hometowns. I chose a career in healthcare because I grew up, my mom was a nurse, and so I had a really great example watching her out in the community, just kind of being the local caregiver, I guess. So that's just what I always wanted to do, was take care of people. And I think that I'm really lucky because I'm also really interested in science, and so I feel like where the science meets the caring is where I thrive the most. I'm most passionate about taking care of young families and making sure that they get the best start. And so I really believe that starts with taking care of women and through adolescence and preconceptionally. I also think that it's important to focus on prenatal care and taking care of that woman, especially in the postpartum period, and just making sure that she's surrounded with lots of support. I also love to take care of pediatric patients, and so newborns and kids all the way up to age 18. As a family nurse practitioner, I just know that when we take care of the whole family unit, everybody does better. I chose to work at CCM Health because I am so inspired by the team that works here and how this organization really strives to bring as many services as possible, as close to home for patients as possible. The amount of outreach services that they have and the work that's done in satellite clinics to make sure that patients have care brought to them is really a pretty special thing. I'm also really excited to be able to work to the fullest scope of my practice. In a setting like this, I'm going to be able to see the patients in the clinic and follow them over to the hospital and be a part of this midwifery team-based approach that is really growing and doing a great job taking good care of families. About 5 years ago, I chose to come back to CCM Health for my own maternity care, and I had a wonderful experience with the birth of both of our sons, actually. We really felt like we were known and seen by the whole team. I felt very safe here and very, very well supported. And I had so much faith in the team that was taking care of me. And so I think that was another one of the most inspirational things about me coming back again, was just knowing that I could be a part of the team that did such a great job taking care of me. As a nurse midwife, I'm trained in normal physiologic birth. I'm trained in health promotion and disease prevention. And so I'm very, very attuned, and I really take my patients seriously and try to listen deeply so that if anything is abnormal, we address it right away, and we include people on our team so that everybody has the best outcomes possible. My husband and I also farm organically and regeneratively, and so we grow about 12 different crops at any given time, and we have a small grass-fed beef herd also. So when you aren't seeing me in healthcare, sometimes you might see me helping on the farm. And we have 3 kids also, and they're real involved and like to be working with Luke all the time too. We do have a brand new family member. Belle is our blue heeler that is a rescue dog that we welcomed him to our family here about a week ago, and she is so much fun and doing great. I'm really excited to be starting my practice here at CCM Health in September, and so if you're wanting to schedule an appointment, you can go ahead and call the clinic and get on my schedule. I can't wait to start and building a panel.